let's take a look at some slides of the hamstrings directly from your book. Let's talk a little bit about their origin insertions, but I hope what we're going to do is just fill in the cracks of everything we just talked about, right? Right. Let me ask a couple questions to make sure people were paying attention before we went on break, just to make sure that we know what we're talking about. First, just to make life easier on people, who can tell me the names of the three hamstrings? Mr. Jones, please.
The biceps femoris, semimembranosus, and semitendinosus.
Awesome. Thank you, Mr. Jones. Mr. Ma, leave your hand up because I want you to tell me the names of the three hamstrings.
Biceps femoris, semitendinosus, semimembranosus.
Thank you. Thank you. Thank you. Mr. Lee. Mr. Lee?
Rest room.
No, that's Miss Lee.
Yes, sir.
Oh, hey, Mr. Lee. Hey, Mr. Lee. What are the names of the three hamstrings?
Hamstring. Biceps femoris, some membranosus, some tendinosus.
Mr. Lee, that was gorgeous. Thank you.
Oh,
My hat's off to you. It's already off, but it's off to you again. Thank you. Hey, Miss Lee, since you chimed in, I appreciate that too. Miss Lee, what are the names of the three hamstrings?
Biceps femoris, tendinosus, semimembranosus.
Thank you, Miss Lee. Miss Abelos, what hamstring or hamstrings are found on the lateral side of the leg? They're not really on the lateral, they're all on the back side, but on the lateral back side of the leg.
Well, the semitendinosus, the membranosus are considered medial. Both of them are.
Yes.
But the more lateral one is the semimembranosus. No.
No. So sorry. You're almost more advanced than the question I'm asking. You are absolutely right that the semimembranosus and the semitendinosus come down the medial side of the leg and hook onto the medial side of the fibula and stuff like. I mean the tibia and such. What goes down?
Right, but the semitendinosus is more medial than the semimembranosus.
Yes. Oh well, it depends. They cross over each other actually in a couple of spaces. But I'm asking, what's on the lateral side of the leg?
Oh. The biceps femoris.
Yeah, that's why I meant you were answering a really advanced question because the semimembranosus and semitendinosus are so close to each other. Thank you. Brilliant. Thank you.
Sorry.
No, sorry. You're just like 4 steps ahead of me. That's all. Yeah, I'm used to it. It's okay. I'm humble. I can take it. Okay. Mr. Snell.
Yes, sir.
What are the three hamstrings?
Semimembranosus, semitendinosus, and biceps femoris.
Good. Which one or ones are found on the lateral side of the knee?
Biceps femoris.
Thank you, sir. Perfect, sir. Thank you. Mr. Manzanares. Hello, sir. Sir, what are the three hamstrings?
The biceps femoris, the semitendinosus, and the semimembranous.
Yes. Which one or ones are found on the lateral side of the knee?
The biceps femoris.
Yes, sir. Way to knock it out of the park. Thank you, sir. Mr. Craven.
yes.
Mr. Craven, you're on my screen twice, so I was looking at a different icon. Mr. Craven.
I know I'm trying to phone up.
Yes. Mr. Craven. What? Okay. Mr. Craven, what is the nickname for the hamstrings? What?
Good old hammies.
Good old hammies. That is actually true. I mean, they are called the hammies. Can you give me another nickname? The something muscle? What's the main activity that they help you with? An activity that people on screen might be trying to give you hints to right now.
Moonwalking.
Yes, close enough, sir. They are called the walker's muscle. Yes, thank you.
All right.
Yeah, I love that. Where'd she get moonwalk? Oh, just because she's, yeah. Anyway, walker.
She
Yeah,
get like a flair to it.
they help you walk. To propel yourself forward, you have to extend your hip and flex your knee, and that's exactly what hamstrings do. So they're your walker muscle. Cool. Thank you, thanks, sir. Yeah. Miss Dimitrik. Yes, Miss Dimitrik. What are the two actions of the hamstrings?
They are going to flex the knee and extend the hip.
Yep. Pull my whole leg back and bend my knee back. I love it. Yep. Extend the hip, flex the knee. Perfectly said. Thank you, ma'am. Thank you. Mr. Bose.
Yes.
Mr. Bose, what are the names of the three hamstring muscles?
Semitendinosus, semimembranosus, and biceps femoris.
Yes, ma'am. Which one or ones can be found on the medial side of the knee?
Is it semimembranosus?
Yes. And I remember that.
Semitendinosus?
Yes, thank you. I remember semimembranosus because M sounds like M for medial membranosus. No, but you're right. They're both, those two are found on the medial side of the knee. Perfect. Excellent. Thank you. Thank you. Miss Dang.
Yes.
Miss, you're so cute. Miss Dang, what is the name of the three hamstrings?
Semitendinosus, semimembranous, biceps femoris.
Beautiful. Semitendinosus, semimembranosus, and biceps femoris. Beautiful. Thank you, Miss Dang. Thank you.
Sir.
Thank you. Mr. Thornton.
Yes, sir.
Mr. Thornton, what is the nickname for the hamstrings?
Did you say nothing? Walker muscles or something
Yes,
like that?
yeah, the walker muscles, because they help you to walk, literally. Awesome. Thank you, sir. Well done. We'll take it. Mr. Godot. You're there somewhere. Mr. Godot? Dear Mr. Godot? Well, I'm not supposed to use terms of endearment. Sir? Mr. Godot? Do I even see you? You're here. Mr. Godot? Going, no, you're not. Okay, all right. Okay. Miss Hendrickson.
Hey.
What? Hey, sorry. I know you're maybe in a head fog. I apologize, but just what are the names of the three hamstrings?
Biceps femoris, semimembranosus, and semitendinosus.
Absolutely perfect. Thank you, ma'am. That's enough.
Thanks.
Yeah,
Don't make it too hard.
yes, let's not. Right when I called on you, I'm like, let's not push our luck here. Hey, Miss Pugh.
Yep.
Miss Pugh, what is the name of the three hamstrings?
The biceps femoris, semitendinosus, semimembranosus.
Very cool. And Miss Pugh, which one or ones are found laterally on the knee?
The biceps femoris.
Yes. Which one or ones are found medially on the knee?
The semitendinosus, semimembranosus.
Yes. What are the two actions of the hamstrings?
To flex the knee and extend the knee.
Flex the knee and extend the hip.
Hip.
Cool. And what's the nickname for the hamstrings?
The walking muscles.
Awesome. Thank you, Miss Pugh. Yes. Mr. Craven, you raised your hand, sir. Yes.
Yeah, I have a question. So like we had a demonstration on the hamstrings like not too long ago in class, and we were talking about the semitendinosus and semimembranosus, and it came up where like the attachments form, like one kind of went towards the tibia and one went towards the fibia. Right?
So,
Maybe?
yeah, so, yes, kind of. I'm going to show you a slide here in a second. So it's not that though, exactly, but I want to make sure I'm telling you this to you correctly. Okay. You have two bone. I'm going to show you, let me show you a slide. It's going to be a lot easier than me showing you with my hands.
Okay.
Your tibia, by the way, is your thick leg muscle below the knee.
Right.
Your fibula is the thin one on the lateral side of your knee. So since it's on the lateral side of your knee, what hamstrings do you think attach to it?
Well, so this was kind of going where my question went too, because Mr. Overman brought up a good point on like remembering it was like the semimembranosus was more medial. Membranosus starts with an M.
That's
and
how I
then the
remember
other one, tendinosis, goes to the tibia, starts with a T, and it's more like lateral too. So it's like easier to kind of remember it that way. So I was wondering if that was like right.
It's right to say, well, no. Well, for one thing, I worry about using the word lateral over on two muscles that are found on the medial side of your leg.
Is it more lateral than the other, or is that not? Because if it's not true, then it's going to blow my mind.
Okay.
I've been thinking about it like the whole time.
Okay, here's the problem. And I'll show you a slide and it'll make sense. And by the way, I don't think it's that important because to me, the semimembranosus and semitendinosus are like the two-headed muscle of the biceps femoris. So I work on them together essentially, but they do attach in different locations. So what happens is the semimembranosus tends to be the most medial of the two in most spots. And it comes down the medial leg and it hooks to the back of the tibia. The semitendinosus comes down the back of the leg on the medial side as well, and it kind of wraps around the tibia and kind of goes underneath your knee in a really interesting spot. You guys might be able to feel this on yourself, but you're feeling for a sensation, not an object. On the medial side of my knee, below my knee, below the bump down here, kind of up on my shin, you should feel this sensitive spot if you rub it. It just feels really sensitive. That's the best I can describe it. It feels flat and sensitive. It's very sensitive because three important muscles attach there. And these three muscles are the semitendinosus, which makes it extremely medial right there, Mr. Craven, but not very medial all the time. The semimembranosus, the belly of it's more medial up here, but it doesn't matter. That's why we're getting really nitpicky. It's more important where they insert. Semitendinosus inserts down here, kind of into the side of your tibia, this very medial portion of your tibia. The sartorius comes down across and inserts in the same place. And your inner thigh gracilis, your adductor gracilis attaches down there. They all attach, I'm going to show you this on a slideshow right now. They all attach into a spot where three tendons come together. The sartorius, the gracilis, and the semitendinosus come together in this little thing that looks a little bit like a bird's foot or a goose's foot. And it's actually named the goose's foot. It's actually named the pes anserinus, which means goose's foot or goose foot. And that's this location on the tibia. And I've got to show you this in a slide because all my little hand signals are not doing it justice at all. So let's do that right now. I think we've, no, don't do that. Cancel that. Try to present the right thing here. Okay. Mr. Craven, you raised your hand too, sir, please.
Yeah, it just came to me. So like the pes anserinus is like the reverse pec minor kind of deal, almost. In terms of like gang signals.
Oh, thank you. Yes, I couldn't see another comparison besides that, but yes, it is our reverse gang signal. Yes, pec minor, pes anserinus. You're absolutely right, because they come together. It's three tendons coming together into a local anchoring spot, which is why that spot tends to be very tender on your leg.
So we got Crips and Blood kind of going now.
We do. We are, yes, absolutely. Yeah. So this picture is really hard to see. Oh, I've got my pointer in the wrong area, sorry. So Here is your semimembranosus coming here. It is more, this part of your semimembranosus is the most medial belly, of your hamstring. So the meaty part here, right? And it comes down here, but there's some of it underneath the semitendinosus, so it comes here too. So it's really hard to say it's the most medial, but if you had to really argue, you'd say if you're rubbing the side of the back of somebody's leg, you're probably hitting their semimembranosus. Although with the strokes we're all doing, you're probably hitting both. The semitendinosus is not as medial, it is more lateral, but I don't even like saying that because they're both found on the medial side of the leg, right? But here's what's interesting. The semitendinosus comes down and it wraps up to that spot that I was telling you about. This is the pes anserinus here. I'll get you a better shot of it in a second. And once it does that, it becomes extremely medial. And the semimembranosus kind of comes down here. It's very hard to see from this picture. And here's, by the way, the biceps femoris with the two heads here. So let me take you to a picture where you can, oh, maybe that one will help us. Kind of does. This is looking between somebody's thighs in a very strange manner where we've cut them in half down the center. Here's the semitendinosus coming down and attaching to the inside of the leg here. This is actually a better picture. Semitendinosus coming down in here, attaching in here at the pes anserinus, where the gracilis and the sartorius all attach. So here's the semitendinosus, gracilis, and sartorius all attaching this spot that's down in your tibia, down in this area down here in your tibia. It's on your medial tibia. So I'm not trying to skirt the question, sir. It's that the semitendinosus and semimembranosus really just are your most medial hamstring muscles. And if we go back here, to me as a massage therapist, it's important that I know that they're located on this side of the leg. They're going to this side of the knee, both. Semimembranosus and semitendinosus go to this side, the medial side of the knee. We can argue where the belly of the semimembranosus medial, and that is how I remember it too, the belly is more medial than the semitendinosus. But they are both found on the medial side of the leg. That's what I don't want to confuse people with. And the biceps femoris are both found on the lateral side of the leg. I'm sorry for running that into the ground, but I just want to make sure we're clear on that. Cool? All right. So this is a picture of the back of a leg. This is the picture of a posterior view of a leg without quads and without adductors. Your quads would be filling in a lot of this space here that you just see flesh here. Your adductors would be filling in this space here that you see flesh here. We are just talking about the hamstrings here. They all essentially, I'm going to explain there's one exception to this, but they all essentially have an origin on what's called the ischial tuberosity. Remember, your hips are divided into three bones. This is your ilium. This is your pubis up here. And this is your ischium. Your ischium is in your tuschium. You sit on your ischium. People used to call this, I mean, I still do, they call this the sits bone because you sit on it. When you guys sit on a really hard chair and your butt hurts, it's hurting from right here. This is what's hitting the chair. You have to sit on a hard chair usually to feel that, but you can. You sit on a little concrete bench or something that hurts. This is your sits bone. It's your ischium, and it's got a whole bunch of bumps on it. We call those bumps the ischial tuberosity, and they are there for one purpose only, for the hamstrings to have an origin on. And you see how this thing looks like the handle of a coffee mug? It is the handle of your hips, and it is literally there so that when I am bending over, my hamstrings can grab onto that handle back there and pull me back up. That's why it's there. It is a handle to pull your hips back up and get them to posteriorly tilt, to get you to extend. That's what it's there for. From here, this is where they all converge, and this is where, oh, you guys can't see me again? Hold on. Come on, there we go. This is where they all converge up here, and this is where they can get stuck together. This is what I was saying. Sometimes I'll put my elbow right here, not down here. Right here, you can actually fill this divot in people. On everybody, you can fill this. And you can drop, oh shoot, don't do that to me. You can fill this divot on people, and I will drive my elbow slowly up through this valley. all the way up to here. And when I massage you, by the way, I like to massage until I run into this without invading your privacy. But assuming you're comfortable and things like that, I run up until I basically hit this bone. Because I want to get these origins up here, these attachments. Anyway, I'll split between these two things. We see the long head of the biceps femoris here. We're going to talk about the short head of the biceps femoris. Short head of the biceps femoris does not attach up here. It actually is hooked to the femur. And then the semitendinosus and the more medial semimembranosus. But you see how really one's on top of the other. And then the semimembranosus kind of hooks onto the back of the tibia. The semitendinosus keeps going down further and hooks to the medial proximal shaft of the tibia. And I'm going to show you that again in a better slide. Miss Abelos, please.
Like from this depiction, it shows that the semimembranosus is more broad than the semitendinosus. So technically, it's more medial and lateral than the semitendinosus.
Yes, this is why I was like, I don't want to go down this rabbit hole. You're exactly right. It is broader, and the semitendinosus is staying on top of it. But you're right. Actually, it looks like it's true on both counts. Good point. Good point. Because of this bottom section is what you're talking about coming out from underneath here. You're right. Yeah, I don't disagree with that at all. Miss Carrillo, please.
So it's like semimembranosus is more like semibroadenosis.
Yeah, sure. Yeah. But from my point of view as a massage therapist, what I care is that you have two heads, semimembranosus and semitendinosus, going to your medial side of your this area, your leg. And because remember, your thigh is not your leg. This upper section is not considered your leg. This lower section is. And I've got two heads going to your leg down here. So, and that's what gives me balance to my knee. And so when I think somebody's leg is buckling outward laterally, it's usually because the medial muscles are too tight, and I massage both the semimembranosus and semitendinosus. When I think their knee is buckling in, it's often because this side, the biceps femoris, are too tight, and they're actually causing the leg to buckle in, believe it or not, because they're pulling the leg to the side. Ms. Carrillo, please.
Okay, so just to make sure I understand, so this is the knee, and if the semis are tight near my pinky, that's more medial, so it'd be like that?
Yes.
No.
Yes, because it shortens on that side, right? It shortens on this side, which pushes it to the opposite side. That's exactly right. If it shortens on the medial side, it pushes it laterally. If it shortens on the lateral side, it pushes it medial. And as Mr. Craven pointed out to us very astutely too, I think it was Mr. Craven, I hope I'm following all the people that said stuff here, that could cause problems with patellar alignment too, because the patella is not always coming along for the ride too. So that's another problem that can happen, even though the patella is not attached to any of these muscles. But it's got a groove in front that it needs to stick to. Okay? And it's very easy to kind of remember if you know that the tibia is the medial thicker bone and you know the fibula is the lateral smaller bone, and you remember that the biceps femoris on the lateral side, it's very easy to remember they insert into the fibula. And it's very easy to remember the semitendinosus and semimembranosus insert into the tibia. And the semimembranosus or broadenosus inserts into the posterior head of the tibia, and the semitendinosus goes behind it and then inserts into the medial side of the tibia. Let me show you a better slide. Did somebody raise their hand? I just want to make sure I didn't miss anybody. Okay. So let's see here. So really quickly, or really slowly even, we've got plenty of time. Let's look at the biceps femoris. So we are looking at the muscles on the lateral side of your leg. And by the way, I also don't want to confuse all of us with lateral and medial. All of these are on the posterior side of your leg, right? But the posterior is a rectangle. There's space to be on one side or the other of the back side of the leg. So these are all found on the back side of your leg. When you're rubbing something on the back side of the leg, these are what you're rubbing. So where was my little pointer? Come on. There we go. So the long head of the biceps femoris The long head of the biceps femoris is what you see here. It has an origin of the ischial tuberosity. This is just this big ischium bone with all these bumps on it. We call it the ischial tuberosity. Yep. And it goes down and inserts into the head of the fibula. The short head is underneath it. The short head is underneath it, right? It has an origin on the lateral lip of the linea aspera. You've heard that before. One of your quads attaches here, the vastus lateralis. It goes all the way up and down here. But anyway, this guy attaches right in here, and it too inserts into the head of the fibula. And you will notice that together they look like one muscle. And I have to tell you, massaging them, they feel like one muscle. It's very hard to distinguish between the short head of the biceps femoris and the long head of the biceps femoris, and I don't know why you'd really need to. Ms. Carrillo, please.
So with how you helped us remember with the quads, so femoris equals fibula.
Sure.
Like they both start with F.
Yeah, I love it. It's exactly right. Femoris equals fibula. Now, there is a slight difference in their actions. The long head goes over two joints. I know it doesn't look like it's going over this joint, but it's crossing over the bone that's made up of this joint. So the long head creates an extension of the hip, of the acetabular femoral joint, and a flexion of the knee. The short head can only create a flexion of the knee. So it's one of those trick questions we ask about the hamstrings when we say what are their actions and stuff like that. Their actions really are the semimembranosus and semitendinosus and long head of the biceps femoris all create an extension of the hip and a flexion of the knee. The short head of the biceps femoris only creates a flexion of the knee, if you want to get really technical. But I don't worry about that because, for one thing, I've never been able to just massage the short head of the biceps femoris as opposed to the long head. I run them together. And so I tend to treat them the same, basically. But anyway, you've got two heads going to the fibula down here for knee stability. Yeah? Then, here's the semitendinosus. And the semitendinosus also hooks down lower, but to the ischial tuberosity, all these bumps on your ischium, and they insert into the proximal medial shaft of the tibia at the pes anserinus. Remember what proximal means, right? Proximal means if I have a bone, it's closer to the body. So if I have my leg bone, it's up on the top of the leg bone, on the medial side. So this is that sensitive spot on the inside of your leg. This is your proximal medial side. Proximal up here, medial on the inside, right here is your pes anserinus. And it is a very sensitive spot on your body because three muscles come together there. And I do massage it on people, but I massage it with flat fingers because it's really sensitive. Mr. Craven, please.
Just kind of going back to semitendinosus, semimembranosus, bicep femoris, all that. So like, when you look at it, like to the layman, to me, like it looks so similar to like how like a tricep would be. Like, why do you know why they would like differentiate? Like, oh, well, this is the bicep femoris, and then this is the semitendinosus, you know, like they look. You could almost break up the bicep femoris and say that that was like the whole thing. Like they look so similar that like it can almost be one muscle because they all have like the same origin, and the insertion's a little bit different, but so is the tricep. So it's confusing to me.
Well, the biceps femoris is considered one muscle, right? It's a two-headed muscle. That's why it's called the biceps femoris. So it's a two-headed muscle. So the biceps femoris is a two-headed muscle, and the reason they call it that is because they both heads insert into the same place, the femur. Right. And so they like to call it, by the way, it's all arbitrary, but they like to call it one muscle. You're right. Whereas the semimembranosus and semitendinosus insert in different places. The semitendinosus inserts into the pes anserinus on the proximal medial side of the knee, and you're going to find the semimembranosus doesn't do that at all. It inserts in the back of your the posterior aspect of the medial condyle of the tibia, but it means the back of the dog bone is what it literally means. The
Right.
condyles are those bumps on the side attached to the back. So you've got them going to different places, and that's why they count them as different muscles.
No, I mean, that makes sense. It's just, I think just like visually, they look so similar.
Oh gosh,
Like,
sir, and in my entire massage career, I've essentially massaged them as a two-headed muscle. I put the semimembranosus and semitendinosus together all the time. In my brain, I put them together. I might work them a little bit different when I get down to the knee because I know one kind of goes under the knee into the pes anserinus. But to me, they're one big, thick muscle, and I look at the biceps femoris as the same thing, right? I'm looking at channels, and so I don't even make that distinction. You're absolutely right. Mr. Dimitrick.
So is this because, like, if they dissected the body, they could pull these parts separately and say, hey, these aren't really one giant muscle. They're separated by fascia or whatever.
Yeah. Well, they're actually not separated by fascia. They actually get kind of stuck together by fascia, but it has to do with where the tendons are inserting. And so these tendons are inserting in different locations, and in some ways they're starting in different locations. I don't know if you guys looked, but there's no doubt that they're inserting in different locations. Biceps femoris, both heads insert into the head of the fibula, both at the same spot. They join together in a unified tendon and insert in that. The semimembranosus and semitendinosus do not do that. They do not have a unified tendon at the end. One inserts into the back of the tibia, the other one inserts into the medial side of the tibia. Those are two different locations. I do think they have fascial connections. They get kind of stuck together up here. And they also all in a way start out from different areas. The biceps femoris actually starts out from kind of the higher part of the ischial tuberosity, and then the semitendinosus comes down a little bit lower, and the semimembranosus a little bit lower than that. So they're also in some ways starting out from different spots too, although all that's glued together, I admit. So it's just, and by the way, it's just names. Like, it's names in the sense that, like, why is a town a city or a hamlet or whatever? Because somebody decided to give it that name. So to both your point and Mr. Craven's point, we could have gotten away with labeling them different. But what's important for you guys to know is you've got two heads going into a fibula, you've got two heads going into the tibia, and that gives you two heads on both sides of the knee, and they can affect knee stability. Right? And when you rub them, because we're not surgeons, and I don't mean like we're not smart enough to be surgeons, I mean because we can't fill that level of detail. As Miss Avalos pointed out, the broadness of the semimembranosus with the semitendinosus on top of it just makes it feel like one big thick muscle. And the biceps femoris, even though I know one head only goes to the femur and down to the knee, because it's underneath the other one, that just feels like a big thick muscle. And I can't really distinguish more than that, and I don't need to. Does that make sense? But I do need to know their origin and insertion because I want to make sure I work it all the way up to the ischial tuberosity. Otherwise, I'm missing a huge part, and those are the parts that are avascular, and I want to take it down across the knee into the tibia and fibula. And many therapists don't, because they're terrified of the back of knees. And it's true you don't want to poke right directly in the back of somebody's knee pit, their popliteal region, but you can massage down the sides with detail and kind of connect that into the tibia and fibula, and that's important. Mr. Richards.
So for the final exam that's not open book, do they give us pictures like this, and then we can work out by looking at the picture where it would insert and or you know?
Yeah, and they're actually
you just show.
Yeah, they're actually
work out where it comes and goes.
Oh yeah, that's exactly what the final exam is designed to do, sir. And there are pictures that are better than these in some ways. You've seen the type of pictures that are on the final exam, and you will get to see them again on Tuesday. And you'll get to see them again at the end of the class after that. And again at the class after that is we're going to add more and more pictures, but you'll get an idea because we want you to be able to identify them. But Mr. Richards, your point is actually extremely important. For those of you that want to be amazing at anatomy, it's about knowing the two attachment points. It doesn't matter if you know which one's the origin, which one's the insertion, but if you know where something starts and where something finishes, you can identify it every time. So look at this slide that's up right now. This slide is actually very much to Mr. Richards' point. This slide, come on, little pointer, work with me. It doesn't work. There. This slide shows that there are 3 different origins here. This is why the biceps femoris is called one muscle. It has one origin and one insertion, right? Well, it's got another origin here, but my point is it shares these kind of things. And then the semimembranosus here, going down here, semitendinosus here, and you can't see it's actually on the inside. They flipped the leg to show you over here. But yes, knowing that, sir, you'll be able to distinguish between them. Although I'm not sure the end of the year test is that nitpicky. I don't know that it tries to get you to distinguish between semimembranosus and semitendinosus. It tries to make sure that you understand the difference between semimembranosus, semitendinosus as a group, biceps femoris as a group, things like that. Because those are working knowledge kinds of things to know. We don't actually go into the level. I hope to go in the level of detail right now for those of you that are geeking out on it, because I do too, and it's really helpful for you to be a really good massage therapist. It's super helpful. For those of you that are like Mr. Metrix, like I was running out of stuff to do in my massage, and just sorry, you had mentioned it. This level of detail helps give you stuff to do in a 2-hour massage, because you're like, I know this hamstring goes down around the back of the knee and hooks into this pes anserinus, so I'm going to rub that too. You've now got all this detail to work on. But the year-end test just makes sure, can you recognize the main hamstrings? Like, do you get the concept of where they're at and where they're going? And you're absolutely right, sir. That should be enough.
Just the way they say it, like proximal, medial,
No, we don't ask that. I used to do that. I used to actually give you guys a test, not you guys, a long time ago, when poor Miss Bauer was here, actually. I used to give you tests where you had to literally, and not for multiple choice, had to write down, semimembranosus, and you had the test would literally be like, tell me the 3 hamstrings and their origin insertions, and it was blank. And you had to write down all 3 hamstrings, and you had to say semimembranosus has an origin on the tibial tuberosity and inserts into the posterior condyle of the tibia. And the semitendinosus has an origin of the ischial tuberosity and inserts into the medial proximal shaft of the tibia at the pes anserinus, and you had to write it down from memory, and it was a nightmare. And I stopped doing it, not to be nice. I stopped doing it because I wasn't sure that your ability to do that made you a better massage therapist. Granted, if you could do that, you were pretty amazing. But the point was, that didn't show me that you could find it on a human body and could visually see it and kind of knew where it went and what it did. And so I switched to a much more visual test so that those of you that can do that can ace the visual test, because you know where the origin insertions are, and you're like, I know what that is. That's an ischial tuberosity, and I know what that is. That's a tibia, and that's on the medial side, and that's kind of proximal. That's got to be the semitendinosus. So you can ace that test too. But also for those of you that are more visual and are like, I remember there's 2 muscles that run down on the inside. That's the semimembranosus, semitendinosus. You can do that too. I think it fits more personality types, and I think it's a better test to capture what you need to be a really good therapist, instead of, are you really good at memorizing things like pes anserinus? And you might not even know what it means. Yeah. Cool. Yeah. All right. Awesome. Ms. Carrillo, please.
I'm looking at the slide, and one thing I find really interesting with the biceps femoris, it looks like the attachment onto the fibula is a lot smaller than the attachment for the semimembranosus. The line, it looks smaller compared to each other, but then I do notice the biceps femoris, it's longer on the femur, probably to help keep it in place while it does its thing, but I wonder why the attachment is still very small for a powerful muscle.
Yeah.
It just confused. I just thought it was really interesting because I thought it usually would have a bigger attachment area.
Yeah. It's good speculation on your part. It could mean, and I don't know the answer to this, but it could mean that more of your power for knee flexion comes from the semimembranosus and semitendinosus, or maybe the semimembranosus specifically. It could mean all sorts of stuff. You're right. And the problem with the reason I'm being a little bit like your logic is excellent. But as we all know, they don't really screw into just one spot. Remember, they kind of spider web into this area, and that's where we see it kind of going, but it goes in there. But yeah, I think you're right. I mean, those are things you should be thinking about.
It's cool.
It's cool.
It's great.
It's great. Cool, cool, cool. All right. I think that's it. Oh, I want to make a point. That's not it. But it's darn close to it, and I'll release your homework here. Sorry, the slide reminded me of what I'm supposed to tell you. The shoebox. I've never mentioned this before, so it should not sound familiar. But what happens is, look at this gentleman who's literally grabbing the hamstrings back there. You can do this on many people. Just depends on, you know, how much adipose tissue they've got and stuff. But you can reach back there and actually grab the entire group up high, both the lateral and medial side, just like this gentleman is doing in this picture. The reason this is significant is it helps you in finding the hamstrings. What happens is the vastus lateralis, remember it makes up the entire side of your leg? If your leg is a four-sided box, it makes up the entire side of your leg. And then you've got the adductor magnus on the medial side of your leg. We haven't learned about it yet, but it's massive and it's far, far back. It's so far back that some people include it in the hamstrings because it can act like a hamstring a little bit too. But the vastus lateralis and the adductor magnus create walls, and the hamstrings literally sit down a little bit in the shoebox. Can you kind of see that from this picture, that they're kind of sitting down a little bit in this shoebox? So when you feel for them, you're not grabbing on the sides of the legs, because if you grab on the sides of the legs, you've hit vastus lateralis and you've hit adductor magnus. They're actually living in this little channel that's about this wide that you can grab like that, kind of in this shoebox back there. That's why I call it the shoebox. I don't know if other people call it that, but and I just want to kind of point that out when you're feeling for it. Yeah? Yeah. The shoebox. Cool. That's that. That's it. So today, when you're playing with somebody's leg, kind of go back there and see if you can't kind of shake them out. You can kind of usually feel them kind of in the space that's in there. And we say they live in a shoebox back there, or between the vastus lateralis and the adductor magnus. Yeah. Yeah. Thoughts, questions, anything as I release your homework here? Your homework is a test, a 16-question test on the hamstrings. There's only so many questions you can ask on the hamstrings. And a chapter questions for chapter 16, which is on Eastern massage. I think your book refers to as Asian massage, that we will talk about on Monday. I always feel funny talking about Asian massage to my Asian students. But anyway, we will attempt to do that with some dignity. Anyway, on Monday, we'll talk about that. So you should only have 2 homework assignments. 16-question test and the chapter question tests, and that's it. Yeah? Mr. Godot, did you pop back on? I just saw you. Maybe, maybe not. All right. Okay, everybody, work on your tests. I'll be around. If you get them done, you can have a free weekend.